Hi friends, I'm Dr. Romal Mehta from Upper Govindnagar Clinic, ERA Clinic. I'm here to talk about one of the common diseases affecting us in the monsoons called Leptospirosis. And this is in series of my lectures which I have made earlier. The earlier video was about dengue. So what is exactly Leptospirosis? Leptospirosis is an acute and often severe infection that frequently affects the liver or other organs and is caused by Leptospira, interorgans. The Leptospira are often transmitted to humans by the ingestion of food and drink contaminated by the urine of the reservoir animal. The organism may also enter through minor skin lesions and probably via the conjunctiva. The incubation period is about 2 to 20 days. So what are the symptoms and signs which will be affecting us during leptospirosis? The leptospirosis is the more common and milder form of the disease and is often biphasic. The initial or septicemic phase begins with abrupt fever to 39 to 40 degrees centigrades, chills, abdominal pain, severe headache, and myalgias, especially of the calf muscles. There is marked conjunctival suffusion. Leptospirosis can be isolated from blood, cerebrospinal fluid, and tissues. Following 1 to 3 day period of improvement in symptoms and absence of fever, the second or immune phase begins. Leptospirosis are absent from blood and the cerebrospinal fluid but are still present in the kidney and specific antibodies appear. A recurrence of symptoms is seen as in the first phase of disease with the onset of meningitis. Uveitis, which can be unilateral or bilateral and usually involves the entire uveal tract, rash, and adenopathy may occur. The illness is usually self-limiting, lasting 4 to 30 days, and complete recovery is the rule. Leptospirosis with jaundice must be distinguished from hepatitis, yellow fever, and relapsing fever. Laboratory findings. The leukocyte count may be normal or as high as 50,000 with neutrophils predominating. The urine may contain bile, protein, cast, and red cells. Oliguria is not uncommon and in severe cases uremia may occur. In cases with meningeal involvement, organisms may be found in the cerebrospinal fluid during the first 10 days of illness. Early in the disease, the organism may be identified by dark field examination of the patient's blood or by culture on a semi-solid medium. Cultures take 1 to 6 weeks to become positive. The organism may also be grown from the urine from the 10th day to the 6th week. Diagnosis is usually made by means of serological tests, of which several are available. Agglutination test, microscopic using live organism, and macroscopic using killed antigen become positive after 7 to 10 days of illness. Peak at 3 to 4 weeks and may persist at high levels for many years. Thus, to make a diagnosis, a fourfold or greater rise in titer must be documented. The IgM ELISA is particularly useful in making an early diagnosis, and it is positive as early as 2 days into illness, a time when the clinical manifestation may be non-specific and is extremely sensitive and specific, 93% of the time. PCR methods, presently investigational, appear to be sensitive, specific, positive early in disease, and able to detect leptospiral DNA in blood, urine, cerebrospinal fluid, and aqueous humor. Serum CK is usually elevated in leptospirosis patients and normal in hepatitis patients. Complications: myocarditis, aseptic meningitis, renal failure, pulmonary infiltrates with hemorrhagic are not common but are usually the causes of death. Iridocyclitis may occur. Treatment: various antimicrobial drugs including penicillin and tetracyclines show anti-leptospiral activity. Penicillin, example 6 million units daily intravenously, is said to be beneficial in severe leptospirosis, especially if started within the first 4 days of illness. Serous hexamia reactions may occur. Observe for evidence of renal failure and treat as necessary. Effective prophylaxis consists of doxycycline, 200 mg orally once weekly during the risk of exposure. Doxycycline 100 mg twice daily for 7 days can also reduce the severity and duration of symptoms if given within the 3 days after onset of disease. Prognosis. Without jaundice, the disease is almost never fatal. With jaundice, the mortality rate is 5%, and for those under age 30 and 30% for those over age 60. So hopefully, friends, this is a little bit of information on leptospirosis, which keeps on affecting many people in Mumbai during monsoons. Hope it gives you an insight into the disease and helps you to prevent it. So thank you, and keep tuned and listening for more videos. Subscribe to ERA Polyclinic, Upper Govind Nagar, Dr. Romal Mehta. Thank you.